Pulling the Trigger is sponsored by Easy Vape North Shore, the industry's leading direct retailer of the highest quality personal vaporizers, e-cigs, vapes, and Canadian-made e-juice. Located at 987 Marine Drive in North Vancouver, or you can check them out online at www.easyvapecanada.com. You can also donate to our Patreon account. Patreon is a membership platform that makes it easy for artists and creators to connect with their fans and get paid. That's at www.patreon.com/MarkHughesComic. And please like our Facebook page at facebook.com/PTG604. Welcome to Pulling the Trigger. I'm Mark Hughes, and this is my podcast, as always, produced and edited, posted, and curated by the wonderful Taylor Murray. Pulling the Trigger is sponsored by our friends at Jackal Events. Jackal Events is a Vancouver-based event organization company specializing in political events and comedy shows. The next Jackal Events event is March 31st, Danny Polishuk live in Vancouver. That'll be at the Rickshaw Theatre, which is 254 East Hastings, Vancouver, BC. Tickets are available at www.picatic.com. That's www.picatic.com. Comedy for me is what I will be opening for Danny March 31st. So that's going to be great. Comedy Shocker Edmonton. Edmonton, look out. We're coming for you. Western Canada's premier XXX rated dark and dirty comedy show. April 4th at the Comic Strip. That's in West Edmonton Mall. The tickets are available at the Comic Strip website, wem.thecomicstrip.ca. Mike Dambra is going to be headlining. Sam Tonning, the Comedy Shocker co-producer, is going to be emceeing, and we have a whole lineup of people that you're going to love. Vancouver Comedy Shocker, April 7th, Rickshaw Theatre as well. Tickets can be purchased at www.comedyshocker.com. So, what's going on? How am I doing? My coffee was on the other side of the room, so I had to get it. What's going on for me here? Well, I'm in Edmonton right now. I just did a show called Unholy Jokes. Thank you, Will Hannigan. It was a great show. It was at a venue called the Church of John. And it's a dirty show, and I had a great time, and I've had a great time in Edmonton. I've been doing their open mics, and I like this town. I don't care what anyone in Vancouver says. I don't care what it's fucking cold here, but I like the salt of the earth, blue collar, smaller town feel where people are nicer and friendlier and stuff. Sue me. I saw an interesting thing yesterday. Here's a social justice puzzle. I was watching a black security guard, and I'm pretty sure he was a recent immigrant, or at least not born in Canada, based on his accent, apprehend an Aboriginal female shoplifter yesterday. And she took a swing at him when he tried to stop her. I watched the whole thing, too, by the way. There was no injustice here. He was just trying to stop her from shoplifting. He was very diplomatic, and he didn't even touch her. He only grabbed her bag. She took a swing, turned into a melee, quite violent, and she called him a nigger. There was a bunch of black people around, and they got really upset. And then there was a bunch of native people around, and they were getting upset that he was doing what he was doing. Who wins in the Oppression Olympics on that one? Who am I supposed to be offended on behalf of, I wonder? I don't know. It's a puzzle. Send in your responses to Pulling the Trigger, if you care enough to. I'm trying to think. I always get stuck on what to talk about on these things that's going on in my personal life. My ferrets are doing okay. They're being watched. I have London Fringe Festival maybe I should plug that. I actually have the dates and venue. Let me just draw this up here. I've never been to London, Ontario before. So it's London, Ontario, not England. No, sent. It will be, let me just have where to go. Okay, here we are. London Fringe Festival. The dates are Wednesday, May 30th, Friday, June 1st, Sunday, June 3rd, Tuesday, June 5th, Friday, June 8th, Saturday, June 9th. And that's at Pecunier Hall, 710 Dundas Street, London, Ontario. And I will be doing my one-man show, Tragedy plus Time Served equals Comedy. Bringing it to the East. Probably stop by in Toronto while I'm there. It'll be cool. And I am gearing up to move. Oh, I also got into the Nanaimo Fringe. Forgot about that. Nanaimo Fringe is in August. I am gearing up to move out of BC. Even if it's just temporary. Even if it's just 3 to 6 months. I'm getting ready to go. It seems like I always have to justify why I don't like Vancouver. One thing I can definitely say is if you're not into the beaches and mountains and the outdoorsy shit, Vancouver isn't that great of a city, other than the weather. Any other city I go to, all the things I like, pretty much any city over 1 million has any stuff I want to do. So, if you could just transplant me anywhere and I'll be fine. And besides, I can't stand this pretentiousness in Vancouver anymore. I mean, I know that's everywhere, but people shit on Toronto for being the center of the universe, but when you go to Vancouver, that's how they talk, and it's like, I've lived there almost my entire life. 5 years old, I moved to Vancouver from Calgary. I don't even remember Alberta, and I've just never really felt at home in Vancouver. I mean, I've never felt home anywhere, and this is nothing I haven't talked about before. But these cities that are more gritty, maybe blue collar, not as glamorous, whatever, however you might want to put it. I always find I get along better with people there, and I just feel, I don't know, I feel more at ease in them. That's about it. That's all I got. That's what's going on in my current life. So, this week's episode. What's the date today? Today is March 21st. So tomorrow, you'll be listening to this March 22nd. So as we know, one of the common topics I have on my show, on the show you're listening to, is overdose and harm reduction and recovery and fentanyl and opioid epidemic, all that stuff. Our guest today is a clean and sober alcoholic and addict who got clean and sober using abstinence-based 12-step recovery, but works in harm reduction as a nurse. And she sees the people who are pretty well gonna die. It's like emergency issues. These are people who everything the stuff that's going on in their life has caused severe health problems. Now, for my normie friends, normie being someone who is not an addict and does not know much about addiction other than what they read, one of the most controversial topics in mental health and addictions right now is abstinence-based recovery versus harm reduction-based recovery. If you think trans bathrooms or Trump are controversial, you should see some of the arguments that go on between these two and how vicious each group can get. The harm reduction people I know right now are thinking that the 12-step ones are the ones that are the most maniacal. And that is not true. I've seen them both be very dismissive of each other. I am a 12-step abstinence-based guy. I got clean. But before I got clean, I used methadone. And methadone is considered a harm reduction approach. I am glad that I was on methadone for a period of time. It helped me. But I knew my life would never improve to the point where I would be satisfied and happy unless I was abstinent. I needed to be abstinent because I knew the methadone was just a stopgap measure. And I also knew that given the opportunity while on the methadone, at some point, I just knew it in the back of my head, I would use something else. Whether it was crystal meth, smoking crack, or shooting coke. I just knew that about myself. I know there are lots and lots and lots of people who abstinence is not a realistic goal for them. Some people don't want to be completely abstinent. They just want to quit using the drug or substance that is causing them the most problems. Or they want to learn how to moderate it. My opinion on it is, and this is the only time I'll insert my opinion on all this, and you can get offended or not, is I think many people who are hardcore drug addicts, heroin, cocaine, methamphetamine, will probably never have a quality of life that they actually want unless they're abstinent. Not all, just many. I think abstinence is not necessarily something that you can come to immediately. I think harm reduction is something that should be, so whether that's opioid replacement therapy, which is methadone or Suboxone, or, tapering or trying to moderate or marijuana, instead of, and that might be, but I think just from my experience being around hundreds and hundreds and hundreds of people with drug addiction issues, very rarely do I see people who had hardcore talking hardcore drug addictions. Are they able to just kind of moderate and, okay, they may be able to stop shooting coke or shooting heroin or smoking crack or shooting meth, but they're kind of in a place where you can see, and they'll even share that they're not happy with their life when they're using some kind of just harm reduction, just minimal amounts. So, and I know people aren't going to like this and they're going to say, you're just one of those abstinence guys. I'm just saying my experience, what I've watched. I know tons of people who weren't really hardcore drug addicts who didn't need to go to abstinence-based recovery. I sit in my 12-step meetings sometimes and I can tell, and I know this is probably, now the 12-step people are going to get mad at me. I can tell they just needed to get a hobby. Maybe just change their friends. Like, they get so clean and sober for a period of time and they're pretty well okay. Like, they're not like a lot of people I know who get clean and sober and get more fucked up because they're not medicating anymore. But what do I know? I'm just a guy sitting here, right? And everyone has to discover this stuff for themselves. My biggest beef with the way treatment and rehab is offered right now is there's too much of a divide between options. If you don't have any money, if you're poor, if all you have is welfare or anything like that, probably all you're going to get is Suboxone and put on a waiting list for a treatment center. If you have money, you can be put into a treatment center that's more often than not abstinence-based. They'll have Suboxone and opioid replacement therapy along with the program, but generally the goal is to be abstinent. I don't understand why the programs aren't being tailored to the individual. Are we asking, when people go into treatment and things like that, or are seeking treatment, what do you want to do? Is a goal being asked? Now, if the goal is being asked, because I don't know, maybe people are sitting down and coming up with treatment plans, are the options even feasible? If someone says, I want to be abstinent, is that something that's being encouraged? Because I know people who say they want to be abstinent. They don't want harm reduction. They don't want opioid replacement. Are they being told, well, that's not realistic, sorry, here's some Suboxone, and that's all we're going to do? Are people talking people out of abstinence when maybe that would be a better course? Are people talking people into are people abstinence people talking people out of opioid replacement therapy when maybe that's what they need? Are people talking people out of moderation and trying to preach abstinence to them? I think these are very complicated questions and issues and concerns that I think are being neglected. And maybe with this new government in British Columbia, apparently $300 million has been allotted for mental health and addictions. Maybe they'll come up with this stuff. I don't know. All I know is I'm a guy who got clean using abstinence-based recovery. I haven't overdosed in over 11 years thanks to it. But I have known a lot of people in the last number of years who have overdosed and died. Many, 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 many people. And forgive me if I'm an asshole and I seem harsh, but enough fucking around with some of this stuff. And I think sometimes when there's an epidemic that's going on right now, I think suggesting people, just drink it on weekends and, just do coke. Don't do the other stuff. Like, fuck off. This is deadly right now. And I know lots of quote unquote normal casual drug users who, sure are playing Russian roulette with a lot of this stuff. And I know a lot of them who've died too. I know people who've died who weren't even drug users. They just tried it once or twice and they got a hot shot. Got some fentanyl and whatever they were doing. So, I don't know. What do I know? I'm rambling now. Our guest today, her name is Kinnon Ross. And like I said, she is a nurse who works with at-risk patients. That's the term I'm coming up with. She has a better term for it. And she lives and works in two different worlds and has to grapple and wrestle with that all the time to try and figure out how to best live her life, but also deliver the best healthcare that their clients deserve, her patients deserve. So why don't we meet Kinnon Ross?
Vacuumed. I totally vacuumed.
Do you have a good vacuum?
I do.
How much did your vacuum cost?
We got it on sale, so it was like $500 or something.
Fuck, that's a good vacuum.
It's one of those crazy Dyson animal ball, like...
And it is, can you eat off the carpet
pretty
when it's
much,
done?
yeah.
I got a vacuum. I was going to buy it. Like, I'm a rookie at all this stuff, right? Because I've always, in all the places I've ever lived, I've never needed a vacuum. It's always been laminate or whatever, right? And my buddy who used to sell vacuums said, no, you need this. You can't cheap out on vacuums. Like, they break... Like, the motor apparently breaks if they're shitty.
Yeah.
Or not shitty, they're cheap.
Yeah.
So I spent $300. And then a mouse ate through the tube.
No.
So it still kind of works. The motor works, everything works. But it probably lost about 25% sucking power.
That sucks.
Yeah.
Well, we had one before. And then when we got the dog, we were like, wow, this vacuum is shit. So, like, it wasn't taking... We didn't think the dog shed, and then we'd vacuum and be like, wow, the dog sheds. But then we got a new vacuum, and now it's like,
nice. Totally
different world.
Nice.
So, yeah.
Vacuums revolutionizing life.
Totally.
Changing
everything. Totally.
Welcome to Pulling the Trigger. I am Mark Hughes, as always, and today I am joined by Kinnon Ross. Kinnon and I know each other from support groups.
Correct.
And she's a cool person who... she's one of these guests that... Through talking about other things, I realized, hey, she's neat. She should be on this podcast. So, welcome.
Thank you.
Yeah. So, what do you do? Who are you? What do you do?
Well, I work as a registered nurse here in Vancouver. And I'm obviously in recovery. So, it's been... the process of being in recovery has... really changed my nursing practice for sure, and has given me sort of a different, I don't want to say outlook, but definitely approach to what I'm doing, because I'm part of, the support group system that you and I were talking about earlier, but I also work extensively with people who are using harm reduction techniques, and I teach harm reduction, and I encourage harm reduction, and work sort of with people around their addictions, and then sort of exist within recovery from addiction as well. So it's a really interesting sort of middle ground place to be.
You're kind of an ambassador, right?
Yeah. Recovery!
Just to clarify for our listeners, what Kinnon and I do is abstinence-based recovery.
Correct.
And you work in harm reduction.
Yeah.
So since you're a professional, can you explain the differences?
Absolutely. So abstinence-based recovery is exactly as it sounds. It's a form of recovery where it's sort of like a cold turkey. A lot of the time it's a cold turkey situation where whatever, substance is being abused is completely removed from the person's life. There's very little attention paid to substitution therapies, if you will. Whereas harm reduction is not at all an abstinence-based approach. And it's actually more of a sort of spectrum, if you will, where it's a lot of steps that are taken to reduce harm in people's lives when they're using substances. And it's also, very medically, very science-based. So abstinence-based recovery a lot of the time is based on sort of historical 12-step approaches or things like that, whereas harm reduction is totally different in that it utilizes sort of the newest evidence-based medical substitutions or even just techniques for using drugs which cause less harm.
Okay, a lot of information there, but hold the fucking phone. What's your dog's name again?
Oh, her name is Mac.
We are joined by Mac.
We are.
She's in the room right now sniffing my backpack that smells like ferrets. What kind of dog is she?
She's a pug cross.
She's so cute.
Her mom was a Boston Terrier Beagle and her dad was a pug.
She's very, very cute.
She's very nosy.
It's because I have the ferrets. I'm very popular with dogs. Okay.
Yeah.
Dogs. So, all right. A lot of information there. Okay, so how long have you been a registered nurse for?
5 years.
How long have you been sober for?
18 months.
Uh-oh. There's a bit of a story there, I bet.
Absolutely, there is.
Why don't you tell us your recovery story?
Yeah, for sure. I went to nursing school when I was 30. So I started nursing school in 2009. I'm pretty, like, I don't know, I was a normal drinker then. Well, sort of. I mean, I was a binge drinker, but it didn't have a huge effect on my ability to...
It wasn't different than anyone you were hanging with.
Exactly.
Yeah.
Exactly. You know, like I could go out on the weekends and have a couple beers and you know, stop. Being the big thing is I could stop drinking. And I made it all the way through nursing school and you know, I did quite well. And then when I started working as a nurse, it was, there's a lot of emotional labor that goes into being a healthcare provider. And I think that was sort of part of my undoing. And, you know, I didn't have the coping mechanisms to deal with, the reactions that I was having to, you know, hearing other people's stories, whether it be like their trauma or abuse or, you know, witnessing really wasn't like trauma, like accidents, like people coming in ambulances or anything. Interpersonal right? Trauma, you know, hearing...
Which is the gross kind.
Yeah. A lot about, you know, really terrible childhoods and exploitation and...
Just to clarify one thing, were you working in addiction and mental health nursing before you got into recovery? Pretty much,
okay. Yeah. I mean, I think I worked on a general medicine unit, if you will, but I think working as a nurse in any acute setting in Vancouver, you end up working with mental health and addictions and more now than ever. But basically, I was working, I was doing shift work. I was, you know, sort of struggling to transition into that. Sort of that loss of identity as a student and trying to gain an identity as a professional. And, it was a really hard time that first year of practice, and my drinking sort of started to increase. And then I had, a couple of people in my family pass away over like a really short period of time. And it was sort of like, I just kind of became unhinged. Like I had all this grief and then, you know, struggling to do shift work and 12-hour shifts and emotional labor and, you know, taking care of all the people in my life. And I just sort of imploded. And like what happened was like the ultimate sort of kicker was that I was in a training program through BCIT that was, you know, part of my professional development. And I was away from the bedside. So I wasn't actually providing hands-on nursing care.
It's like you're not a nurse anymore.
Yeah, I was a student again. And it was just like my drinking and using just exploded.
Is that because you weren't accountable to people anymore?
Exactly.
You didn't have to be, like, you fucking up wouldn't hurt anyone.
I wasn't going to kill somebody if I was hungover, right? And, I mean, the thing...
Where's the fun in that?
Right? I mean, the thing is that it was, like, I never went to work hungover physically. I was emotionally hungover all the time. But what would...
So are most people, though.
Yeah, exactly. But what would happen is, you know, if I was an hour late, I could always bullshit my way through it. Like, I could manipulate any situation so that people would still think I was wonderful and doing, you know, a great job. So I finished this training course and it was like I was supposed to start this, like, really intense critical care, like, literally breathing for people nursing job. And I kind of knew I was in trouble, but I was still really in denial. I had actually started going to support group meetings, like, probably a month before I finished that class because I knew I was in trouble.
Is it because you knew that you're drinking and did you use drugs too?
Yeah. Cocaine.
Oh, nice.
Loved it.
So you knew your drinking and drug use was going to be a problem because this thing that you're doing is going to be very serious.
Yeah. Well, and I
lives depend on you not being fucked up.
Yeah. Right? And I was also starting to receive all sorts of cues from my friends that maybe I was taking it a little far.
So you're not like them anymore.
Yeah, I'm not like them anymore. And, you know, I had a couple of friends in particular really express concern for me. And I was just like, fuck, whatever, I'm fine. You know, like denial through and through. And essentially what happened is my very last day of clinical, so I'm still a student, I'm not like the nurse in charge yet, I collapsed because I hadn't been eating and sleeping. And, you know, I mean, who needs to do that when you're...
Gets in the way of doing blow.
Yeah, totally, right? I didn't have time to eat or sleep. I was really busy in the bathroom. So I collapsed and I was taken to the emergency department at the hospital I work in. And the doctor there was like, you're super dehydrated. Your blood sugar's really low.
This is a colleague.
I don't know him, but it's in the hospital I work in.
Right.
So I'm shitting my pants, right? And this is where it all got very real for me, because he made a comment about how they wanted to check to see if I had a urinary tract infection. So he wanted me to give a urine sample. And I was just like, fuck no. Like, I am not giving anybody a urine sample. So that's when I really started to realize that, like, all right, I'm actually in big trouble here. And, I was expected to be at work like a week later in like my actual orientation position. And I couldn't concentrate during the classroom. Like the orientation leader was like, "Are you still with us?" So I was like, "Oh, yeah." Like just no concentration. Couldn't write a paragraph. Like I was just a mess. I did that first set of orientation shifts. I did the 2-day shifts. And then on the night shift, I just my dexterity was gone. I couldn't do things in the right order, like no muscle memory. And the nurse that was orienting me actually asked me if I was okay, because it was like, I couldn't do what I was supposed to be doing. So when I got home that morning at like 7 a.m., I got loaded and, called in sick and got loaded. And then, I reached out to a friend of mine who's another nurse in recovery, and I just said, "I'm fucked. I don't know what to do." And she told me her story and everything that she had been through. And so I immediately called the College of Registered Nurses, and I called the union, and I just said, "I can't work. Like I need help." And this sort of like month after that is a bit of a blur, but eventually, after a couple of assessments and a whole lot of phone calls, I ended up in a treatment center in Ontario.
Homewood?
Yeah, you got it. Homewood.
I went there for PTSD treatment.
Oh, yeah. Yeah. It's a pretty...
Sober. I've been sober almost 7 years.
It's a pretty impressive facility.
I left after a week.
Did you?
Yeah.
The food?
I didn't like being in an institution again.
It's such an institution, too.
Yeah, it's like a hospital, basically. And I'd been out for long enough, and it just, all the institutional shit came back to me. Like,
yeah.
I started pacing around more people who I didn't know, because it's a community-based.
Yeah.
Right? It's a community model. So they'd say to me, "Hey, how you doing?" I'm like, "I don't even fucking know you. Why you asking?" And then I was like, "I can't do this."
Yeah.
But anyway, I've heard great things about the program nonetheless.
Yeah, well, it saved my life for sure. That's where like the reality of my addiction and the fact that like I was not at all like any of my friends, but exactly like all of the alcoholics and addicts that I knew, it really became clear there. So yeah, I spent like 40 days there and came back to Vancouver and, you know, felt actually worse emotionally when I got back, as you do when you first get sober, and was lucky enough to be able to just sort of fall into this community. Now, I mean, the expectations around a nurse who's in recovery are obviously pretty strict. Like, so there's a whole series of like contracts and stuff where, you know, you have to basically agree that you will be abstinent.
No harm reduction for you.
No harm reduction for me.
Yeah.
And I mean, the drugs that I was using didn't necessitate harm reduction, luckily, but like I do know nurses that have been in that situation and they can't, like, they're not allowed to work. And it's crazy. Because sometimes people need to be on opiate replacement therapy forever. And that's okay. But apparently it's not okay for nurses. So
is it because, like, let's just say hypothetically it's methadone that they have to take for replacement therapy? Is it because you're kind of high when you're on methadone and you could screw up things and stuff like that?
There's a chance, yeah.
Because I don't care. I know the medical profession likes to say that you don't get high off of methadone. That's total bullshit, by the way. I was on methadone. I was fucking high. When I was in the joint and there was heroin or methadone available, I'd get methadone first.
Lasts longer.
Way longer. You wake up high.
Yeah.
I don't care if the guy puked it up or not. It's cheaper and I wake up high.
Oh, gosh.
But anyway.
But
abstinence for you.
Abstinence for me. Abstinence or bust, right? And I was expected to attend these support group meetings, and I was expected to participate in the programs. And
you also get like a probation officer too, don't you?
It's a monitoring company,
right?
But yeah,
I know people who work for one of those.
Yeah,
I think it's the only one in BC, but
yeah, there's two, and they're pretty closely related to each other. So yeah, basically, I agree that I'll be monitored, which means that for the safety of the people that I'm providing care to, they can ensure that I'm sober and clean.
Random piss tests.
You got it.
Yeah.
So
Still?
yeah, 3 years. So I have to log into this little thing every morning and it tells me whether or not I have to go pee in a cup that day, which is, you know what? It's actually been a really, really big part of my recovery. Like, it really pissed me off at first. There's a ball and chain and this and that. You know, I got a little self-righteous about the whole thing, but ultimately it hasn't damaged me in any way. And
sounds fair too. Let's be honest.
Yeah, especially considering like I am taking care of people, right? I'm taking care of vulnerable people.
If I was in the hospital, I would want to know that someone with a previous history of substance abuse is being monitored. Like, before you do anything to me.
Exactly.
Are you fucking clean?
Exactly.
Did you show up high today or what, right?
How are you?
Yeah, it's like, you don't want a pilot high on coke.
Yeah.
You don't want a nurse or a doctor high on coke when they're doing something.
No,
Like,
exactly. Well, and I mean, we know how sneaky addicts and alcoholics are, right? And I mean, the reality of it is that there are a lot of people that work their jobs high, and not just in the healthcare industry, in all industries. And it gets really interesting when you're in like such a safety sensitive position. And, you know, I mean, the fact that I had the potential for hurting somebody else was actually what caused me to get help. I didn't give a shit about myself. It was about worrying about the fact that, you know, like, I might hurt somebody's grandma just by setting a machine at a wrong level, or, you know, and that was something that I couldn't live with. I mean, I hated myself enough. I didn't care about myself at that point, but that whole notion that I could possibly cause damage to somebody else was horrific. But yeah, so then I ended up back at work, and I started out in a clinic. I didn't end up going back to the critical care unit because between myself and my doctors, we just decided that was not an appropriate stress level for somebody in early recovery. And I, to this day, think that was a really great plan. So I went back to the program that I was working in before I did critical care training, which is where I'm doing a lot of the harm reduction work. And sort of.
So that's a coincidence. Or were you drawn to it now?
Oh, I've always been drawn to it, and I don't think that is a coincidence.
Okay.
I think I always kind of knew I was with my people on some level, you know? And I mean, there's a lot of HIV work that happens there as well, which is something that I've always been really interested in. And, you know, there's so much new cutting edge stuff happening in Vancouver with the Center for Excellence.
Do they have a, for all intents and purposes, cure for HIV now? I know it's not actually a cure, but...
Yeah, it's not actually a cure, but so what they're saying is, basically, we have the medications now that can cause the viral load in your body to be so low that we can't pick it up in a blood test. So you essentially don't have it. I mean, you're always going to have it at baseline. Like, your antibody test will always say, yes, positive. But it's not like we can't actively find it in your blood. So the beauty of that is that if we can't find it in your blood, you can't transmit it. So the STOP program, which is a program, run under the Vancouver Coastal umbrella, is a program where people with HIV who need a lot of supports are managed, basically. Like, they get their medications, they see their doctors. And that has had a huge impact on lowering the viral loads.
And transmission rate, too.
Transmission rate, subsequently, right?
And there's the thing...
Pardon me.
I can't remember the acronym now. It's the preventative drug you take.
PrEP?
PrEP.
Yeah. So that just got approved.
And what is it?
So PrEP is it's like a prophylactic medication that if you're in a high-risk category to contract HIV, then if you take PrEP, like, if you do come into contact with the virus, you are really unlikely to actually catch it.
So it's like a vaccine almost.
It is almost like a vaccine, yeah, but it's an oral medication that has to be taken every day. And I mean, it's a huge big deal because people know that they're at risk for things, and if they can make choices to do things in a safer manner, then they're going to do that, right? Like, it's the same thing as, you know, so yeah, you've got PrEP, which is harm reduction. You've got Insight, like safe injection sites. You've got, you know, the Crosstown Clinic, which runs under Providence, which supplies opiate addicts with clean drugs. And I mean, these are people who have failed methadone, failed Suboxone, failed everything numerous times.
One of my guests was on the Naomi.
Yeah.
It was one of the first Naomi Project people.
Yeah, so it's a really cool project and a really essential healthcare service. So it's really neat to be able to work in an environment that supports people to make good choices and just respects the fact that, you're an addiction, you're an active addiction, and we can't maybe get to the root of that through, extensive trauma counseling right now because you're too sick. And like when I rolled into Homewood, all I wanted to do was go straight to the PTSR program. And my doctors looked at me and they were just like, you have no business doing trauma therapy right now. Like, you're not actually capable of doing trauma therapy right now. To which I was like, whatever, you don't know me. But they were right. Now that I'm 19 months clean and sober, I'm starting to do trauma therapy.
They say you should wait 5 years.
Right?
Yeah. In fact, you'll actually know when you need to deal with it or not. That's folk wisdom. But, in recovery, it'll come up.
Yeah.
When the student is ready, the teacher will appear.
Exactly. Well, in my infinite wisdom, when I was like really starting to crash before I self-reported, I was like calling around Vancouver trying to find trauma therapy.
It's not much.
And put my name on all these wait lists for all these programs. And now, 2 years later, I'm at the top of the wait list. So I have all of this access to free trauma counseling now, which is wonderful. But yeah, we know that the root of addiction is trauma, right? And we know that people are in pain, and that's why they're using drugs and alcohol. That
was going to be a question I had for you. Since you work in the medical field, what is the medical opinion on the cause of addiction?
Yeah, well...
Because, we have the disease model, we have the choice model, we have the behavior model, we have the it's society's fault model, we have the...
Yeah, I can't speak to, a textbook medical definition of addiction, but... the way that it's sort of addressed in the environment that I work in is that we acknowledge that people have trauma and we acknowledge that people are sick. So I guess it is the disease model, if you will.
But it's not a disease like the cold or the flu.
Well, yeah, it's not like, I don't think in the self-help programs, it's seen as like a fatal disease, right? And we know it is, and we know it's progressive. But it's not addressed the same way in the medical field as it is in the support network. So it's interesting because there's not a lot of push. I see harm reduction as a really great tool to keep people alive so that if they did decide to choose abstinence-based recovery one day, they could do that. And, people talk about it and they do dream of it and they know that it's a possibility and they know that it's there. But I don't think that our system encourages people to move towards abstinence-based recovery.
No, I don't think so either. My harm reduction friends are going to get mad at me for what I'm about to say, but I've noticed that there's a rift, a great chasm between abstinence people and harm reduction people, and it seems like they're throwing rocks at each other all the time. Not crack rocks either.
No.
And the abstinence ones can be zealots, and the harm reduction people can be zealots.
Absolutely.
And the abstinence people say, you're enabling, da-da-da-da-da, the only way is abstinence, da-da-da-da-da-da-da. And the harm reduction people say, it's more than one way. Not everyone can get clean the same way. Or being abstinence isn't necessarily an attainable goal for some people, nor does it need to be. Addiction is a spectrum, so you need to tailor the modality and the approach to meet the individual and all this kind of stuff. And we don't like how you're religious. We don't like how you admit powerlessness. It's not a disease.
Yeah,
right?
Yeah. Well, and I think.
What do you think?
Well, here's the thing: hanging out in.
Because you're in both sides.
Yeah.
You're straddling the chasm.
Yeah. I believe really strongly in the ability of harm reduction to save people's lives. And I believe really strongly in the ability of abstinence-based recovery to change people's lives and save people's lives. So it's difficult because I think I don't know, I hear things in abstinence-based recovery like if you're on Suboxone, you're not clean. Or if you're on methadone, you're not clean. And I have a really big problem with that. Number one, I don't think it's any of my business to tell somebody else if they're clean or not. Number two, I don't think that everybody can get to abstinence-based recovery via the road that I got there on, And I don't think that, I just don't think it's my place to tell anybody else how they're going to get to an emotionally well place. And I also don't think that, I think this notion that it's one or the other is problematic. I think that they should be able to work together. I know, right? I know. And like I was talking to somebody not that long ago who said that they wouldn't take their sponsee through their step 4, which is like the big piece of work in self-help programs, until that person was off of their harm reduction medication. And I just about lost it. Like, it made my blood boil. Because I think in the case of Suboxone, certainly, and from what I understand, from what my patients have told me, like, they don't get high off Suboxone. And we know from science that it doesn't hit the receptors that create euphoria, whereas methadone does. So it's actually one of the reasons people don't like Suboxone. But I find Suboxone is like a mechanical thing. Like, it's just filling a receptor, right? And if that receptor is full of Suboxone, it means that it can't be full of fentanyl, and that person's not going to die. So why shouldn't they be able to proceed through 12-step based recovery? Like, I just think that the intention, and if you look at the traditions in 12-step recovery, like, the desire to be clean and sober is technically all you need to be a member.
Guess the way I look at it, if I'm sponsoring someone and they're on methadone and they're like, let's do the steps, I'm like, no, because that's not what I did.
Right.
And that's only because I'm an amateur. I'm a layperson.
Yeah.
All I got is my experience.
Mm-hmm.
So I got off methadone and then started doing the 12 steps.
Yeah.
Right? So if someone wants to do it a different way than me, I don't feel qualified to start doing anything different than what I already did.
Fair
I would
enough.
totally refer someone. That doesn't mean I'll drop them.
Yeah.
Because you can sponsor people in ways other than just taking people through steps.
Absolutely.
It's a relationship you're developing.
Yeah,
And
it's connection.
and you're also modeling better behavior and being there for someone to talk through stuff. And
Not judging them.
you're not judging and giving rides and having coffees and having laughs. And it can be just as simple as that, right?
For sure.
I'm not big on taking guys through the steps anyway, though, right? Because I think sometimes that's not really how I did it. I did the steps, I've done them, but my sponsor and I were more working on like, okay, here's my problem today, how do we get through it? And he would help me. So that's what I do with people.
Yeah.
You can be on methadone or Suboxone or anything and do that stuff. Yeah. But anyway, I think one of the problems with 12 steps is it was developed in a time when there were no harm reduction or opiate replacement therapies or anything like that. Harm reduction on the timeline is new.
Oh yeah, absolutely.
Very new. It's not even 20 years old really yet, right? Or sorry, it's older than that, but the way it being the popular or the de jour,
the prominent application,
right,
if
is
you
only
will.
2000s.
Yeah.
When Insight opened, pretty much is when it started becoming the
yeah.
Yeah.
Well, and Insight was really sort of the big first, like, people were like, "You're gonna do what?"
And they're like, yeah,
we're gonna do this. Yeah. And I mean, it's a freaking amazing program, and again, there's so much evidence behind it. But and I know people that are like fully clean and sober and off of all substitution therapies, and they were Insight patients. So maybe, we need to look at it more as a spectrum of like, okay, so right now I need harm reduction techniques that are not going so that I don't die, or so that I don't contract hepatitis C or HIV, or, create this massive abscess that's going to make me go into septic shock where I will die.
Or have to get your leg cut off or
something
like
or
that.
Brain damage. People have septic emboli that go and they have strokes, and, and it's... That stuff can not 100% be prevented, obviously, but it's more likely to be prevented if you're seeing a nurse every day, multiple times a day.
Okay, we've shit-talked 12-step modalities. Let's shit-talk harm reduction for a minute. What do you see? What do you see the cons as harm reduction being presently applied?
I don't think that a lot... I mean, and again, people will disagree with this, but I think, I don't think people were I don't think it was intended to be a permanent thing. Like, I think that when we started to have the science around particularly replacement therapies or, things like that, I don't know that anybody intended that somebody would be on methadone for the rest of their lives. I kind of feel like it was supposed to be a harm reduction technique.
It was like a bridge.
Yeah, like a bridge, right? Where okay, we're going to get you off of heroin. We're going to give you this medication. It's going to help you to stop using street heroin. Then we're going to taper it and we're going to help you move on with your life. And I only speak from what I know, but I don't see a lot of that. You're probably one of the 5 people I know that's been on methadone and went off of it.
I had to do it against doctor's advice, too.
See, and there's the other thing.
I went rogue.
Yeah.
And they were not pleased with it, right?
Well, I know that there's a lot of doctors that disagree with their patients on the speed of the taper. Right?
The way he wanted to do it would have been 6 months.
Mm-hmm. And you weren't having it.
I was already dope sick.
Yeah.
I'm a junkie. I know how it works, right?
Yeah.
I'm already sick. Let's just get this over and done with, right?
Yeah.
And no, you might relapse. And I was like, it might sound cocky. I knew I wasn't going to relapse. I was done.
Yeah.
Because I didn't like methadone. I was like, what I will always say about methadone is it helped me get off street drugs.
Yeah.
Which then prepared me to be abstinent.
Right.
Right. Because I couldn't stop using street drugs.
Mm-hmm.
Not even opiates. I was using speed and stuff.
Yeah.
And as soon as I got on methadone, I was actually, I didn't want to get high on anything.
Right.
The last street drug I ever did was in May. And the last dose of methadone was in September.
Wow.
Yeah.
That's pretty impressive.
Yeah,
That's really fast.
Yeah. And I was just like, okay, we're good.
Yeah.
Right. Now, I've said this before. I got off methadone because I wanted to transfer to a minimum security institution, right? So It's not like I went one day, okay, I want off methadone.
So you had a carrot dangled in front of you? I did.
But the carrot made me go, okay, actually, I think I do want off this shit anyway. Because the thing I didn't like about methadone, I couldn't read a book.
Yeah.
I'd start nodding off.
Yeah.
I couldn't finish a page.
Right.
Because I'd pass out or nod off. And I was like, and I wasn't even in the pleasurable part of the high was gone because you become accustomed to it. Mm-hmm. So it's just the shitty part. It's the part where you can't function. And I was like, and I also knew I'm not going to be able to have a decent life with this shit.
Yeah.
Right? This is going to, if I can't read a page of a book, what hope do I ever have to, right? And I went, okay, so this is, the transfer is the thing. The methadone got me off the street drugs. The transfer got me off the methadone, and I've been off it ever since. Right? 11 years later.
Yeah.
But you're absolutely right. I haven't met too many people who got off methadone.
Yeah. And I think the other thing that happens with people, particularly, a lot of the things that I've seen is what you were just saying, you were using speed on the side. So, we might be dealing with your opiate problem with methadone, but what about your stimulant issues? Right. And I think that, obviously, I know firsthand there is no medication to taper you off of stimulants, and it sucks. But
they're researching stuff right now, though, aren't they, for coke and
yeah. I cold turkeyed it because that was the option that I had. And I think that's the option that a lot of people have. But I also had to be institutionalized to do that. So I don't know. I guess that would be my one thing about harm reduction is that I don't want to be called a harm reduction hater because I'm not. I love harm reduction. I work in it. I support it. I 100% support harm reduction. But I just wish that there was a way that we could use it as an actual vehicle to move people towards a better quality of life.
Here's the rebuttal I hear against that, because I am associated with people who work very closely with street entrenched addicts on the downtown east side, or people, whatever term, addicts, fuck it.
Yeah.
Some people have so much trauma they can't, abstinence isn't realistic. And when they get off, so they're using heroin and other drugs in a sense as a form of psychopharmacology.
Yeah.
It's self-administrated, so they get off and they try abstinence. The symptoms of their mental illness come back too much. And it's blah. And they go, and I believe that.
Absolutely.
Here's my disagreement. I don't believe everyone's like that.
No, neither do I. Well, you're not.
No, and I'm fucked. I have severe PTSD.
Yeah.
Severe. It's really, I get triggered by the stupidest shit, right? One of my guests who I had on the podcast, Billy, he was the guy who was on the Naomi Project.
Yep.
He said what he didn't like, he was on prescription heroin.
Yeah.
As a junkie, I'm like, My mouth started watering when he
Yeah,
started
yeah.
talking about it. I remember, and I was in the joint when they started talking about this prescription heroin program. Guys in the joint were like, what? And they wanted out so they could get it.
Yeah.
I'd never actually met anyone who'd done it and gotten off of it, though. And what Billy told me was that what he didn't like about it, where it failed him, he couldn't leave the downtown east side because he had to be nearby to get a shot at 3 times a day.
Yep.
So you get your shot in the morning, but you don't want to go too far because you got to get one at lunch.
Yep.
And then you don't want to go too far because you got to get one for dinner.
Well,
And how do you get a fucking job if you're tied to it like that? He said he got prescription heroin wasn't as awesome as it sounded because he was just high all the time.
Yeah.
Which is great. But he also said, like, it just felt like, okay, there, mission accomplished. Okay, now what?
Mm-hmm.
Like, where do you go?
Yeah.
And he didn't feel he could function to go and get his life together or anything like that. So,
well, and I know a lot of people in that program, and I've worked with a lot of people in that program and in that program, and I think, like, for some people it's so great, and to see people, like, get their lives back is so cool. And those people are, like, some of the most incredible people I have ever met. You know, my patients show me things every single day that I would have never noticed about the world. And that's one of the things I love about nursing so much. But it's like, you know, like, if I have a patient that's been in hospital, you know, they've come in with an endocarditis or something like that, and they've been on the unit for 6 or 7 weeks, and they're pretty much clean, aside from their opiate replacement therapy, and then we're, like, gearing them up for discharge, and my heart just drops because I have to send them back to the fucking downtown east side. Like, you could send a completely straight-laced sober person down there and they would come out loaded. Like, it's not... Our system fails in that we don't actually have anywhere for people to go when they want to live differently, when they, you know, like, and it's a containment policy.
that's what 12-step groups did for me more than anything else, is they gave me somewhere to go.
Yeah.
People to help me get my life together.
And teach you how to do things,
life
right?
skills.
Yeah.
Seriously, like, I had to be taught the most basic stuff by a group of people who weren't, like, professionals. Because I would have felt too humiliated and like, what the fuck did you just tell me to do, right?
Yeah.
Like, it was just like, no, dude, I remember I had to go through that shit too. Don't worry. It's kind of weird, but here's what you do. And I'm like, oh, okay, cool, fuck.
How do I file my taxes? How do I, because the other, like, you know, if you live in support.
Oh, I was even lower than that. The shit I had to learn. I had to be taught how to eat at a dinner table and stuff like that, right? And not be weird and stuff. So.
Yeah. Well, institutionalized, right? Yeah. And I just think, like, pardon me. I just think that and I mean, our treatment system is a disaster too, right? Like,
there's only a few beds, apparently. Like, for the amount of beds actually available that are from bona fide treatment centers, there's hardly any.
It's brutal. And we'll do things like, people will be clean in hospital and they're, you know, making all these changes and doing all these things, and you can just see them start to come alive, and then we send them home to wait for a treatment bed. And it's like, you know as well as I do that, like, in that moment where I decided I would accept help, it had to be offered to me immediately, or I would have just been like, meh, whatever, a week later.
Change your mind.
It's not so bad. Yeah. It'll be different this time. You know, I can do this. And, like, I had to make really, like, serious, committed moves to ensure that I wouldn't change my mind. Like, calling my union and saying, I can't work. Like, I had to put things in place so that my life had to change.
Small little moves that are about accountability right off the bat. Like it's a commitment. You calling your union to say, I can't come to work, is a tiny, well, not so tiny, but you know what I mean, commitment. I've actually done something that legitimizes this. Yeah. It's in motion now. No,
but, you know, I really thought that they would throw me a parade when I called in. Like, it was like, oh, look what I did. I did this really huge thing. And they were just sort of like, yeah, okay, what's your name? Like,
press the button.
Yeah, that's it. I was so mad. I was so mad. I was like, hello? Like,
we're the only ones who want a big deal made about us for doing something we shouldn't have been, or not doing something we shouldn't have been doing in the first place.
Like, I'm super fucked up, and I just did this thing that was really proper and ethical, and I don't understand why nobody's acknowledging me. Because I also thought that I was the only addict who was a nurse, right? Or the only alcoholic who was a nurse. And I mean, I knew that I wasn't, but I acted like I was. Like,
that's a good question. Do you notice a lot of, let's not diagnose people as addicts, but do you notice a lot of substance misuse in your field?
Oh, sure. That's a well-known fact.
I know.
Yeah. I mean,
I've got to play dumb with some of these questions sometimes.
I think that somebody told me once that the most overused or abused medication in nursing circles is Gravol. Because it's a sedative in shift work, right? So people, I mean, I misused Gravol. Absolutely I did. Because, there's no way to get off 3-day cocaine bender.
That's what I used to use it for. I'd take the edge off a blow, is what I used to use it for. Yeah. Take a handful of Gravol, and you get a bit of a buzz, and it's neat. And
then you go to sleep.
Yep.
Right? But so I think it does start, and I think it starts really insidiously. That's how it started for me. Really insidiously. I was controlling my sleep-wake cycle. I was controlling my appetite. I was too tired to go to a friend's birthday party on Friday night, so cocaine was great. Right? And then all of a sudden, it was every day. And that's how addiction works.
Progressive.
Yeah, it's progressive.
It's insidious, too.
Super insidious.
What I say to people is, if I had been homeless after one fix, I probably would have stopped doing drugs, right? Like, if it all went to shit immediately. Or you OD'd the first time you did it and you didn't feel any pleasure at all, you would have been like, I'm never doing that again, right?
Yeah.
But it's not like that.
Exactly.
What do they say? First it's fun, then it's fun with problems, then it's all problems.
Yeah.
Right? And the problems and the fun can look different for everyone, but so straddling these two worlds, do you find it difficult to not bring one into the other?
Oh, God. Absolutely. I know that there's a lot of, peer navigation programs in the hospital that I work at, and there's a lot of encouragement for patients to go to support or 12-step meetings. And there's not a lot of people that really want to go because they don't actually think it can help them. And I'm, in my brain, cheerleading, rah, 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 go to that meeting! Because I think it's probably one of the most, misunderstood things in the world. I mean, I certainly didn't understand what 12-step programs were. I knew that they talked about God a lot, and I knew that there was a lot of old men and coffee in church basements. And that's hardly... Yeah, there's church basements and there's coffee and there's old men, but...
If you go to that one we go to... looks like a fucking dance club. You know what
exactly.
I mean? It's for my male heterosexual listeners, lots of hot chicks there too. And for my female heterosexual listeners, lots of hot guys.
Yeah.
Just FYI.
Yeah.
They're extreme... I'm amazed. I see some of these women walk in, because I'm a fucking dude, right? And I'm like... Where do you come from? I've never seen people like you in my life. It's intimidating almost. But
I know the first time I walked into that room, I was like, whoa. Am
I in the right fucking place?
This is 12-step? Really? I was shocked. And I think, it's shiny, happy people, because people...
Which gave me the creeps, personally, but...
Yeah, I kind of at first thought it was, a bit Stepford-wife-ish, there was some, robots, people smiling and kind of nodding, and, it really freaked me out at first, because I didn't actually think that I could ever be that happy, and I didn't think that I deserved to be that happy, and I didn't think I deserved to be fulfilled in my life, right? I just thought that I was a bad person, and... that I had all these difficult times in my life, and that was because I just didn't deserve happiness. And so it actually took 12-step programming to teach me that that wasn't true, and that thinking was actually part of my disease. So, and that's the part that, I really wish I could just scream from the hilltops when I'm at work. It doesn't have to be this way. And you don't have to suffer forever, and you're not alone, and if we had a system that could work with people a little bit better, I think that there would be a lot more abstinence-based recovery. And I think that, I don't want to slag any of the recovery associations in town because they all do a really great job. But I think, how come I get sent straight into a medical institution to get clean and sober, but other people don't? What does that say about our priorities as a community, and what does that say about our city's ability to actually help the people that want help?
Treatment center I went to, I only went because I was a federal inmate on parole.
Yeah.
They got double the money for me.
Yeah, what's that?
I don't know.
That's
Think
horrible.
about that next time you don't commit a felony there, loser. Fuck.
Get on the felony train if you really want good treatment.
I'm someone's meal ticket. So do you find yourself having to... inadvertently or advertently defend your work against abstinence-based people? Do you have to do a lot of explaining?
People, I don't know, maybe it's because I kind of made a stink the first few times I heard people say that harm reduction was wrong, but people don't generally approach me about it anymore. You know, I do hear stories about, you know, people getting kicked out of their step groups because they're on opiate replacement therapy. And I just, like, it makes my blood boil, and I wish there was something I could do to change it. And I know that the answer to that is actually education. And it's actually, you know, talking about the benefits of harm reduction as often as I can. And it's about people like, I don't know, did you ever use Insight?
No, I went in there once when I got out of the joint, the last time I was relapsed. There was a lineup.
Yeah.
I was like,
I'm not waiting.
But they gave me rigs.
Yeah.
Syringes.
So you did.
Yeah. I guess I did. I used their
right?
resource. Yeah.
Yeah.
Because it was easier to get rigs then. Because it used to be with the needle exchanges, I mean, they'd give you rigs, but it was always like, we can't do this. We're not supposed to just be giving them to you. You have to exchange.
You're supposed to do a one-to-one, yeah.
Right. Once Insight opened, here's a handful. Go for it. And I was like, oh, that's cool. Right?
Yeah. So I think, like, if we could have, like, the stories of more people who have accessed harm reduction and then eventually ended up in abstinence-based living, if we could get more of those sort of displays of how that, like, continuum works, then I think people in 12-step might be able to understand a little bit more about why harm reduction is important.
I think these days, this is me just as an amateur observing things though, right? Harm reduction is a necessary component to treatment now, especially with this fentanyl thing.
Yeah.
Like, it's an epidemic.
Yeah.
That's the only word for it. It's a crisis, right?
Mm-hmm.
We can't, some people just, they're not going to get into a detox.
No.
They're not going to get into a treatment center. They're not going to be able to just go to meetings and stay clean.
Exactly.
So it's just the way it is what it is,
Yeah.
right? It's a ambulatory, right?
It's effective
Yeah.
too.
Yeah.
You know, like, I know there's a guy that I follow on social media who he used to use Insight on a regular basis and, you know, I think he ended up like in a coma at St. Paul or at the hospital at St. Paul's. And then, you know, like eventually went to treatment at Onsite, which is the,
detox upstairs.
The detox upstairs. Yeah. And like, he doesn't practice 12-step recovery, but he lives an abstinent lifestyle, you know?
Is that Donovan?
Yeah.
I don't think he'd mind us dropping his name.
Yeah,
He's
probably
pretty open.
not. I've never met Donovan.
Yeah.
I really want to meet Donovan, but, you know, I've been following his Instagram for years. And
Donovan Patrick Mahoney, for anyone who's interested, he's very open about his life. It's all good.
I love his story, though. I just think it's so powerful, and I think that it actually does show, like, okay, like, this guy started out here, and then he went here, and now he's here. Like, he's teaching freaking yoga in, like, Thailand, you know? Like, I don't know.
What a Vancouver story, though, eh?
Isn't it?
From the downtown east side to the yoga studios of Kitsilano.
Yeah, it's great. It's so great. And I don't know. I don't think that we give people enough chance to, like, I had to be removed from Kitsilano to get clean and sober.
Because this was your war zone.
Yeah. Like, there's a bar on the corner and the dealer stood outside it. You know, that's how it was for me. Like, the dealer was just, like, in my peer group, right? It was just a guy who realized that all his friends were doing coke, so he started selling coke.
He's your buddy who sells dope.
Yeah.
Yeah.
And it's like I got off the plane coming back from Homewood, and Greg and I were driving home, and, like, around the corner, past the pub, and, like, there's dudes standing on the corner, and I was like, I'm fucked. How am I going to do this? Like, I'm in Kitsilano and I can't do it. So how do we expect people to do it on the downtown east side?
And yeah. But you know what? People do it.
I know, and
there's a treatment center down there.
Yeah, of course.
And people get clean there. In fact, that's that treatment center in particular used to be. It's different now. It used to be, back in the day, if you could stick to it and not leave, you'd probably stay clean.
Yeah.
Most of the guys who finished that 90-day program, it's still 90 days, but it was 90 days back then.
Is that heart related? Yeah.
If you could finish it, you'd probably stay clean. Because if you can do it down there,
exactly,
you can do it anywhere, right?
And
Insight and stuff wasn't around back then, right?
Yeah, and I mean, 12-step programs will say, like, you can stay clean and sober in any and all situations, and I think that's true. And there were days when I doubted that. You know, and there's always that one day where you can't, and that's when you relapse. And so I think it is not environmental, and I don't want to say, like, that's the only reason people can't stay clean. But I think that, you know, you need the odds stacked in your favor as opposed to against you. And, you know, we know that people who are living in poverty and who are, sick, whether that be with addiction or any of the other physical ailments that are associated with trauma. There's just so many obstacles to overcome. But that's, again, why I'm so glad that we have harm reduction, because I think it can give you a glimpse into the fact that somebody cares enough to make sure that, you're going to get this service provided to you, and we want to engage with you as the healthcare system. We don't want to push you away or alienate you or, make you feel like you're not worthy of care, because you are. Everybody's worthy of care, and I think that the way that harm reduction works in that it's right on the street, it's right at the street level, and it's in the alleys, and it's in the SROs, and it's in recovery rooms, and it's just so cool how, what did you say before? It was it's portable, right? It's hard to avoid it. So, and it's common knowledge now that sharing needles isn't a good thing. So, if you really look at it, the fact that there's so many clean needles available it makes it so much easier.
I used to shoot dope in the late 90s and early 2000s when there was needle exchanges, so there was lots of needles. It wasn't like the old days where 200 people were sharing one needle.
Yeah.
But people would still share them, though.
Yeah.
Because they weren't as easy to get, and you had to be... you couldn't get large amounts of them, really. Or you could, but it wasn't that easy, right? So unless you were downtown, you're fucked. So I'd be getting high in like Broadway and Fraser, for example, right?
Yeah.
We're partying.
Yeah.
We only got one rig.
Gonna do it.
And the needle exchange closed.
Yeah.
Oh, well. Right?
Exactly.
That's how I contracted Hep C.
Yeah.
Right? Doing shit like that. I got rid of it.
Yeah.
Thanks to the interferon treatment. But
nice.
Fucking lucky duck, man.
Yeah.
I got it. I did the interferon treatment in prison 2002. Tested non-detectable for Hep C 2003. Stayed clean until 2006. Shared needles again when I relapsed. But I didn't contract it again. Oof. I know.
You didn't reinfect? You're lucky.
Fuck am I ever, because I wouldn't want to do that treatment again.
Yeah, that's changed a lot too now.
Oh, it's not as bad anymore?
No, it's not. But it's still not good.
No, well, when I did it, you had to do 3 shots a week. No. Yeah, 3 shots a week of the interferon, 3 shots a week, and the antiviral 5 pills a day.
Yeah.
And for 6 months, you feel like you have a really bad flu.
Yeah.
I lost 20 pounds.
Yeah, it's still pretty gross. Like, it's still not... I mean, you really have to beat the shit out of the body to get rid of a virus like Hep C, right? Like, Hep C is a nasty, strong virus. So, yeah. But it's so... I mean, that's one of the things that's really cool about HIV work is that... it's not cool that people are co-infected, but it's cool that there's so much science now and, like that we can clear people of Hep C, right? And we can control HIV. And, if you get people down to this like undetectable viral load, then if they do happen to be at Broadway and Fraser and the needle exchange is closed, they're not going to contract to the person they're sharing that needle with, right? And that is amazing to me, because it's just dodging another bullet, right? So
keeping people alive.
Yeah.
That extra day or
exactly.
whatever. Yeah.
So maybe something happens and, maybe they hit their rock bottom and they decide like, okay, I do want to fight for my life, because that's what getting sober is it's like 10 rounds in the boxing ring with like your biggest, baddest enemy. So,
which actually ends up being yourself in a weird way,
right?
That's a bit esoteric for most of our listeners, but that's for another episode with a different guest. What's life like now?
Oh man, life's great. Life is really good, actually. I was giggling. I was talking to an old timer at one of our self-help meetings this morning, and he said, "So how are you?" And I said, "I don't even know. Like, I don't even know." It's so cliche, but I don't even have the words. Like, I have this amazing job. I have a great family. I have this incredible community of people in recovery around me. I don't want to die anymore.
Nice.
I get to give back to my community. I get to be present. I get to I don't know. If you would have told me 15 years ago that I'd be here right now, I never would have believed you. And I just think that everybody deserves this.
Would it be fair to say that abstinence-based recovery has made you a better harm reduction worker?
Oh my goodness, absolutely.
There's a paradox for you.
That's going to make some people's heads explode. But yeah, I absolutely. I always liked harm reduction, but now I actually understand it. And, it just allowed this level of empathy compassion that I have inside me for people who are in active addiction is like tenfold now that I've actually been through getting clean and sober. Like it's a fucking hard process, and it's not something that people can do alone. And, just really quickly, I think that's the one thing that I wish I could give to all my harm reduction patients is that sense of community that we have in abstinence-based recovery. Because as much as we sometimes really resent our people, our colleagues in recovery, our peers, if you will, that's what's made the hugest difference for me, is having clean and sober friends who I can talk to at any hour of the day about any little thing, who don't think I'm crazy, who understand that, life can be really, really challenging when you're not medicating.
You can take the social guards down, too. Yeah. You don't always have to look like you got your shit together. You're allowed to admit you're fucked up. You're allowed to admit... My first few years, I was suicidal a lot. Yeah. And I could say that and it wouldn't freak people out.
Oh, yeah. Absolutely.
Just because you think about killing yourself doesn't mean you're going to do it.
I had periods of that in my first year. Really bad.
In your first 5 years, you'll have a few more.
Yeah, I'm sure I will.
Yeah, especially as the stuff starts bubbling up.
But it's also knowing that that's okay.
No, that's fine. Right? Of course. It's a mood-altering device. That's why you're thinking about it, right?
And it's normal. Mm-hmm. I just think that... there's a lot that the abstinence-based recovery world could learn from harm reduction. And I think that there's a lot that harm reduction could learn from abstinence-based recovery.
Yeah, I totally agree. I know both. I interact with both in one and interact with another. One of the things that bugs me, and there's no solution to it immediately, is a lot of people ask me for help because I'm very open about my life and my issues. I don't go on and on about how I got clean. I'm kind of quiet about how I got there, but everyone knows I'm clean. Yeah. No booze, no marijuana. Yeah. Clean. So people will approach me and say, "Hey, how'd you do it?" And I'll be like, da-da-da-da-da-da. And I'll be like, yeah. That 12-step shit. And I'm like, no. It's not as bad as you think. Trust me. If I hate it and I do it, it's okay, right? Yeah. And it's also discouraged by a lot of people too. Yeah. Like people be, whoa, hold on. You don't need to do it like that. And it's like, whoa. Like, why do you, someone's asking for help and you're immediately saying, no, that doesn't have to be the way you do it, right? Yeah. Here's the thing I find. Most people have a problem when it comes to the stuff we do. They don't like the God thing. Yeah. And our society is becoming more not humanitarian, what's the term?
Humanistic?
Humanistic. So atheistic, basically, or agnostic, right? Yeah. It's becoming more, religion is receding, where science and all that kind of stuff is becoming more pop. So it's, the God thing is going to be starting to get harder and harder to sell as the years go on, right? Yeah. Anyway.
Well, it was never intended to be religious. It says right in most of the literature, this is a spiritual program, not a religious program.
But you go in and they circle up and pray and stuff like that. It's hard, it's pretty, hard, and there's a big religious book. And anyway, so there's that part. And because harm reduction has started in certain ways becoming part of the landscape, people are like, I have to quit drinking too? Yeah. I just want to quit coke and heroin.
I was so pissed off when I went into that fellowship and saw that they thought that alcohol was a drug, because I didn't think alcohol was a drug. I just had a drug problem, not a drinking problem.
Exactly. And I am the type, and so many people I know are like this as well, that alcohol is, back when I used to do drugs, alcohol was not the one I chose the most. But let's just say lots of jail sentences ended because I started with alcohol. Yeah. I had this saying that I heard at the drug fellowship one. Mm-hmm. I'm allergic to alcohol. I break out in track marks. Right? Or the dealer's numbers at the bottom of every glass. Yeah. Right? Yeah. I'm that guy. Yeah.
Oh, so are a lot of people. I turned into that guy for sure. Like, I mean, I always, I didn't start using drugs until probably I dabbled here and there throughout my whole life. I had a period of time in my early 20s where I really liked speed on Tuesdays though.
Right.
Believe it or not. Only on Tuesdays, which of course would then turn into Friday.
Right.
But that kind of stopped. And then I remember trying cocaine for the first time being like, I don't really like that. And then in like sort of early 2015, I started dabbling with coke again. And then it was like, this is the best thing ever. And right around when I started going to 12-step groups, I remember I was like, well, I'm going to quit drinking. So I quit drinking for 30 days. And I thought it was just like, well, I'm not an alcoholic. But I was probably doing like $300, $400 worth of cocaine a day.
A day? Oh, you're doing a lot of coke.
Oh yeah, I was getting her done.
Oh wow.
Right?
Yeah.
So, but I wasn't drinking.
Right. So
Right?
Yeah.
So I mean, it's all a drug. Shopping is a drug for me. Relationships are a drug. Food is a drug. Like,
well, and that's the other thing is just because you stop using drugs doesn't mean the addictive inclinations go away or predilection. Like I got to watch out for a lot of different things. Sex is one I got to watch out for. Internet is one I got to watch out.
Yeah.
Don't give a fuck about gambling.
Seems
Seems dumb to me. You just lose money, right? But I'm not going to experiment either because I bet you I could start liking it.
I could probably learn to like it.
Yeah. The only thing I'm not is a workaholic because I'm lazy as fuck. That I can quit anytime, and I do.
No problem.
Yeah.
Cold turkey quit.
Exactly. Just out the door. That's it. I'm done.
Yeah.
But those are the things that I find sometimes a bit troubling.
Mm-hmm.
Is that people will want to get help with their substance abuse issues, and I will get asked, and the way I did it is immediately dismissed, and off they go to keep on doing what they're doing. Yeah. Because sometimes it's because I'm so public about my stuff. Sometimes I'm the only person people know of. Yeah. There's someone who goes to our meeting that reached out to me because she didn't know anyone else who'd ever. And I didn't know her. I'd never met her before. She's just on my Facebook, right?
Wow.
Yeah, and so sometimes I'm it. Yeah. And I'm no hero, right? Yeah. But they ask, I go, okay, and they go, no. And I'm not even saying that they're not willing. That's what a lot of our peers would say. No. I think they are. I just wish it was like a bit easier to get them there.
There's so many misconceptions. Yeah. And I think I often think that's one of the things that anonymity makes problematic, right?
You wanted to talk about that.
Yeah.
Go.
Like, yeah. I get that the reasons behind anonymity, and I fully understand the fact that not everybody wants to be open about their recovery, and I think that that's...
Some people can't be for a bunch of different reasons. Not just don't want to be, can't be. It'll fuck their life up. Right?
Exactly. And I think that, that's one of the reasons that we still have anonymity, but... What if I hadn't known that my friend had gone to treatment and was in self-help groups? What if I hadn't known that? I would have been far too afraid to call my union. And I think that the way that anonymity works to protect its members also works against it in that it prevents people from understanding what actually happens in those meetings. And I think that is why people are so quick to be like, fuck that. I ain't going to no meeting.
There's also a lot of horror stories about people who tried it, too.
Yeah.
Some of them are very true, too.
Totally.
Which is why one of the problems with our little deal, our little organization that's not organized, is there's no human resources department.
Of course.
There's no complaint division.
Well, it's not Wellness Anonymous either, right?
So there's a lot of fucked up people there, right? Well, right now there's that thing. Were you at the business meeting thing?
Oh, gosh, yeah.
So, down in the... You know where that came from? You know what caused that? Down in the States, a lot of sex offenders are ordered to go to...
Oh, right.
Yeah, and so, you,
a
woman, who's there because of... For long and short of it, you fucked your job up.
Yeah.
Okay, got to go to rehab now.
Yeah.
So, okay, in order to keep my job and all this kind of stuff, I got to go to rehab. You could be sitting next to a convicted rapist.
Exactly.
Right? And... Yeah. I'm not so. Are we gonna have a bark off?
Don't bark. She might.
That's okay. I don't think that sex offenders should not be welcome there. I think they should be welcome there. But it's this tricky thing. It's like I think women need to be safe too, right? And then there's people at these things. Here, listen, I'm already not doing a really bad job of selling what we do. But there are people there who aren't convicted sex offenders, never been convicted of a sex offense in their life, but are predatory,
Yeah.
right? That's not just men, by the way.
No, it's women.
Yeah,
Absolutely.
yeah, it's all kinds. It's very equal that way. And predatory doesn't just mean sexually.
No.
There's people who try and use people for money.
Yeah.
There are all kinds. It's
Yep.
like you said, it's not Wellness Anonymous.
Yeah.
And you hear these stories and you're like, because you can't start arguing with someone and go, well, that's fucking bullshit.
Because it's true.
No, it happened. Fuck, right?
Yeah.
So all I can do, and all I think we can do,
Yeah.
I'll speak on your behalf for a second.
Please do.
Is typical man, right? Is be better examples ourselves in the real world.
Yes.
And watch for that bullshit when we're in it.
Yep.
Go jack someone up if you see them being a fucker.
Well,
right?
exactly. And I have called other women out. Like, I'm happily married and so haven't had to deal with the whole meat market in any of that kind of
Which
stuff.
is kind of fun as a single guy. I'm not going to lie. It kept me around. Kept me interested.
Well, and it keeps lots of women around too. You know, it's nice to be able to meet people that you could potentially have relationships with who are working the same program as you, who are clean and sober, who...
Sex gets you through some bad nights sometimes, too.
There you go, right?
Yeah. Mutually pleasurable, fuck it, let's do this, right? It has lots of time.
Absolutely.
And even this whole thing where, like, you have to be this amount clean to before... no, that's all horse shit, right?
Yeah,
because
that's not in any literature.
I know people who stayed clean their first couple of years because of a relationship.
Yeah.
The relationship might not have worked out, but they wouldn't have stayed. They wouldn't have stuck around if they weren't dating that person.
Exactly.
Right?
Well, and I think that like, it's those sort of like old like folklore bullshit, actually not from any piece of literature or part of any tradition that can also contribute to like a really negative.
You mean I gotta go there and be celibate as well as abstinence?
No fun.
Yeah.
No fun for you. Yeah. You better not smile either.
Yeah.
You know, like I don't know. It's like the club that you never want to belong to, but then once you're in it, you're like so glad that you belong to it.
Why wasn't I here earlier?
Yeah.
Right.
Like I could have saved myself a lot of suffering if I had just gone earlier.
One of the co-founders of Alcoholics Anonymous, which I'm not saying I go to one way or the other, actually said anonymity can hurt people in two ways. Mm-hmm. He said, where you're just shouting it, basically you're just blabbing about it too much and you're breaking other people's anonymity.
Yeah.
Or you're so anonymous people can't find you.
Exactly.
Yeah.
Well, and I think, I don't know, because I knew that one other person who had gone through the process of, you know, addiction treatment, and like when I did that, I didn't think like, oh, I'm going to have to go to 12-step groups after. I just thought I was going to go to treatment and get fixed and then come home and be better. Like, I didn't understand.
You thought it's like a broken leg or something, right?
I thought it was like, okay, I go there, they'll like tinker around my brain a little bit, send me on back to the coast, and like within 6 weeks I'll be back at work and it'll be like it never happened. Like, I did not understand what it was that I was up against. And it wasn't until I actually really got into the work in a 12-step program, which I may or may not attend, that it like I fully started to understand what was going on and what this actually was. And that like I have an illness. Like it's not like, I don't know. It's like, you know, we go to disease model, but it's like this illness actually like infiltrates every single area of my life and my like entire being down to the core. And I don't have my solution anymore, which was drugs and alcohol. So once I figured that out, I got really fucking scared. Because I was like, I'm screwed. Like, I basically have, you know, nothing to look forward to if I don't get through this. And it's always interesting to me when I see people that are put on like an opiate replacement therapy and then all of a sudden they start smoking crack or something. So I'm like, aha! See, it doesn't matter if you take away that drug. They still have the illness. And it's like, you know, it's that sickness and that sadness is still there. And I think that really speaks to the strength of what self-help and 12-step groups can do, is that they actually teach you about the emotional disturbances that you're living in every day. And that has been the biggest change, right? Is I understand now why my brain works the way it does and why I see things the way I do and what I have to do to negate that for a day. So, I don't know. I just wish that we could like put some sort of like secret broadcast out with like a special code word on it, and if people wanted to know the truth about 12-step fellowships, they could find it there. Because of course there's going to be bad stories, but why aren't we talking about the good stories? The people that have been sober for 30 plus years and who have spent, weeks and days out of every week in that 35 plus years helping other people.
One of the other things that bugs me sometimes is people will give me shit for being too open.
Oh, yeah, I get in trouble
geez,
all the
why
time.
do you have to be so open? Like, can't you just do it quietly and just not... Or why do you need to, like, announce that you're sober? And why do you need to, like, show off about it? So I'm not fucking showing off at all. Mm-hmm. I'd rather not, in some ways, be... Like, I'm glad I'm in recovery. I'm glad for the life I have.
Yeah.
But you think I want to have this thing
Yeah.
wrong with me?
Yeah.
Right? You think I like going to parties and I'm the only one there who doesn't drink, and it fucking I stick out like a sore thumb. Yeah. Not just in my head. It creeps people out and stuff like that.
It does, yeah.
But
I used to actually say that I didn't trust people who didn't drink.
Right, yeah, no. I'll be standing because I do comedy and everyone drinks and does drugs there, right?
Yeah.
And I can see people are getting weirded out by me being there.
Yeah.
I'm not even saying anything,
like,
right?
what are you doing?
But the reason I'm so open about it is because I knew about it when it was time to go to it.
Yeah.
And because, like that example of that girl who reached out to me who didn't know anyone.
Yeah.
And I'd never met her before.
Thank goodness she was able to reach out to you.
I was scared bringing her to the first one, though. I'm like, fuck, she's not going to like this, man.
Yeah.
Because I asked her, do you have any experience with any of this? She said no. Like, she'd never been to rehab.
She's still around?
Yep. I'll tell you her name afterward.
Yeah.
I said, then I'm like, what do you think about God and stuff? She goes, no, I'm not religious at all. I'm like, oh, fuck.
Here we go.
But I brought her to our one.
Mm-hmm.
Because I knew there's younger people and stuff there, so, yeah.
Yeah.
And I'm like talking to her throughout the whole meeting, and someone would say something, you don't have that, that's not necessarily, you don't have, right? I was coaching her through it. I was scared. What if she gets scared away? And I said, they're going to talk about God and praying and all that stuff. I said, don't listen. Like, I said, if it's okay with you, go ahead, but you don't have to buy all that right now anyway. It doesn't matter. Just kind of, you can adapt. And and fucking 6 months later or something, she's still going.
That's amazing.
Yeah.
And not to toot your horn or anything, but you might have helped save that girl's life.
Yeah, I don't know. I just did what people did for me.
Exactly.
Yeah.
And that's sort of my goal, right? Like, I don't I don't know. I recover out loud because it's actually part of my service. Like, it's part of me giving back to my community, and I really want people to know that it's okay, that you're not a bad person, that this can happen to anybody, that it doesn't matter if you're a doctor or if you're a garbage man or if you work retail or if you work construction or if you're a nurse or you're a dentist or, you're still just a human being, and therefore these things can happen, and maybe you'll start to like cocaine a lot one day, and like that's what happened to me, right? It wasn't upbringing, and it wasn't this, and it wasn't that, but it got fucked up, and I needed help, and I knew where to get it. So, yeah, I don't know. I'm really trying to learn more about traditions and stuff so that I don't outwardly offend people, but I don't know, sometimes I outwardly offend people.
There's no way around that.
There's not much I can do about it.
You can try your best never to offend people, you'll always still offend someone. There's no way around it. So just looking at the time, looks like a good place to kind of cap it off.
Right on.
What I ask all my guests, question I ask them all, is there anything that you would like for people listening to this to know?
That recovery is possible. And whether you get there via harm reduction or maybe you just stick around in using harm reduction methods for longer than others, it doesn't matter. That everybody's different and everybody gets to where they need to be. And, maybe you continue using harm reduction products and you still get to have an emotional recovery. I think that that's a possibility.